Good morning. This is Dr. Bill Wyatt again with the American Orthodontic Society, and I want to talk about something that we've discussed several times earlier, and that's understanding the use of these pulpotomies that we use in healthy deciduous teeth. Now, don't try to do them in an infected tooth. They will not work. But in deciduous teeth that are healthy, I have done way over 1,000 of these, and I've never had one go bad. Now, I had an old surgeon who was an MD, old surgeon. The patient that's the dentist that sent the patient to me, I tried to tell him how to do the pulpotomy, and he did not want to try. So he sent the patient to an old surgeon, and they don't teach this to old surgeons. And so this tooth went bad, and that's the only one that I know of that has ever done that. So I want to cover that. This is a marvelous way to bring in many people's teeth, straighten them up without even putting braces on their teeth. And you can do this if you allocate the space out correctly to the people, to the teeth that really need it. And there are two different phases, and I want to cover those two phases and how to do the pulpotomy, and so you won't be afraid. Apparently people are a little shy of doing this, or I mean the dentists that are should be doing it don't do it enough to do this properly. So I'm going to go ahead and show you this. Let's see, I've got to go back over here and get my little arrow going and get this to work. All right, here is the young lady. I'm going to have to erase that we did this on several years ago, and then, if I'm not mistaken, she grew up and married and brought her own little girl back to have her teeth done where she didn't have to wear braces to get them done. Now, you cannot do this if they're too crowded, and if the space is adequate, it is there, and the person has no deleterious habits. In other words, they're not sucking their thumb, swallowing improperly, breathing through their mouth and things that will mess up this, but you can still make it better by doing this. Now here is an example of it. You'll have people come in to you with their children, and they've got 3 permanent teeth that have come in, and you can't see it, but there's another lateral down underneath here that probably has eaten into the crown of this deciduous cuspid right here. So this is what we're going to do the pulpotomy on, and we have to know where that tooth is, and we can see that in X-ray good enough. And so we'll look at it from another angle here on the other side. Now when you do a cut on one side, you got to do the same thing on the other side. Now this one is not near as bad. This one is worse, and this will center up. Here is the midline right here. So these teeth are that far off to the side. Now when we do the pulpotomy over here, we got to cut off enough of this deciduous crown to allow this lateral to come in place. And then when it begins to come in place, these teeth will not be pushed here, and you've made space over here. This tooth will move into that area. Now this is done simply because the tongue pushes on this every time you swallow. If you don't have any habits or anything, and mouth breathers, and you swallow and you push the tongue up there, it will shove these teeth into place. And we are not using nature's way of straightening out the teeth. And this is what I'm trying to get. We've been doing this for 40-something years, and I can't get people interested enough to do this, and there's very few people that do it. You can actually straighten up people, young people's teeth like this. So I'm going to go on here to the next slide, and here is the gap now that we're trying, and you can see the corner of this lateral right there. And I know where that lateral comes in. It goes over here, it gets hung under the enamel of this deciduous tooth, and the absorptive cells cannot eat the enamel part of a deciduous tooth. They can eat out the whole the dentinal portion completely, but they can't absorb the enamel. So that holds this tooth down. So you've got to take that off to get this tooth to come up in here. Now I can cut this tooth. You can do away with the whole darn crown if you want to. And you cut it down, and now you've got your root, and you go down in the root structure and just obliterate that root, and you got to fill it with a hard packed zinc oxide and pack it in there like enamel. Now let's show you how we do this tooth. I don't know why people are so afraid of that. You just don't blow air in that canal. You just let the blood come up in it. Now we're going to take a new burr. I used a diamond once, and now we went to a long bladed carbide burr. And now this is the area up above. We're going to have to do the same thing. That just shows the upper teeth up here. We'll show it later. Now here we are. This lateral down here is underneath this cuspid. It's, if you x-ray it, the enamel comes down over the permanent cuspid, and this permanent tooth cannot come in with the enamel of this tooth on it. And I'll have some people come to me and say, well, why don't we just do an extraction? If you do the extraction, you've got to come over here and do the extraction over here too. Now, if you extract a tooth, you take the crown and the root of the tooth out at the same time. Now, when the root of this tooth is gone, the permanent bicuspid or the permanent cuspid under here will drift forward, and you will lose arch length. And this is why I can't get it into people's head that it's not as good to take the blooming cuspid, deciduous cuspid out instead of trimming it off or cutting it off. You can cut 2/3 of it off. You could cut the whole thing. But if you leave the root, that's going to hold the space where it is, and you save the space. So you need to get rid of the idea that all I have to do is extract those teeth and that'll come in. It'll do it all right. It'll come in, but these teeth will move forward, and you'll be shorter space, and you'll end up having to extract teeth, permanent teeth, if you do that in many of the cases. All right, let me get from here. All right, we're going to do this pulpotomy, and there's the tooth down there, and we're going to need a big portion of this tooth, and we're going to have to take off a lot of it to do that. So we're using, back then we used a long long diamond. Now we use a long carbide burr. That's, you use a brand new one every time, and you can sterilize it, but there's no need in it, because you're going to go in and take that burr. We come down and we cut that tooth right down, and I watch very carefully. Then you get this, and then you can move it forward and cut further here. Then you can just flick this part off the tooth, and you can see your lateral tooth. Now we're going to have to go around that lateral tooth and give it room, and we'll come back and do the pulpotomy in that area. I took a little tissue there, but you don't really have to. The tongue is powerful. It will move this lateral into this position, except this is going to move this way because we've gone over here and do the same cut over here, though we don't need the full space on the right side of the mouth. We're cutting the left side over here. Now, people seem to back away from this. They're afraid to do it. Even the pediatric dentists, I don't think there's a handful of them do this. Now you can come in right here, and I can open this, I can cut this off, and I can pop that away, and I can see my permanent tooth coming over here, and I'm going to take this off and give it some space to room, to move. And it wouldn't mind, I could cut the whole darn crown off as long as I left the root, and these teeth will not move in this area, and you won't lose arch length that way. And these people that say, oh, it's simpler, I know how to extract the teeth, I'll just extract them, and the teeth in the back will move forward, and they don't even know it's moving forward. Apparently, they act like they don't, and then they have to take out a permanent tooth on the case. Now, it's okay to take out teeth if you really need it in there, but I'm not. We're going to try to we're going to save them on this. Now we'll go in here. We'll pop this loose right there, and it'll take that piece of tooth off. I haven't done it yet. Oh, there we did it. Now we pop that away, and now you take this, and you can see your lateral. The side of the lateral root was under this. Now I'm going to go down into the pulp of that deciduous tooth and take that, the pulp, just obliterate the pulp and come out. And then this will bleed. And you say, goodness, it bleeds. We don't mind it bleeding at all. And leave it alone, let it bleed. All right, we mix up zinc oxide and eugenol, and I think this is where people don't really get this stuff thick enough. You put your pile of zinc oxide, you put a drop of eugenol in there, and you just work it, pack it down until you get it so thick, and you blot it out, and you can take a spoon like this, and you can cut the end off of this, and it'll be sticking out from this spoon, this part up here, right here on the spoon. Now you've got a point of hard packed zinc oxide and eugenol to put into that tooth. Now take that instrument, cut it off, it glues, it sticks on the end, and now I've got this tooth over here, and it's got this open. We're going to push that down into that tooth right there. Now there, let it bleed. Do not try to get it out of there. You don't want it out. You really want it in there. It's bleeding and washing this out if there's any impurities. I don't use a rubber dam. You can't use a rubber dam. And you're going to grind the darn thing up when you get down into this area. You do not need to. I have done, I want to say I've done several thousand of them. There are 8 of them you do on each tooth. And over a period of years, I've done, and I've won the Cooley Award twice showing this, and yet people don't do it very much. There's a few brave souls out there that may do it, but just watch what nature will straighten these teeth out. Just leave it alone. Get it if they've got room enough to start with. Now I'm going to insert this into this blood. This is so thick and hard it's like packing amalgam, and I'll shove it down into that area. Now it's pushed it down in there, and I smooth it off, and then I put some more on there, just kind of smooth it up, and then take your burr and kind of knock the edges off of this so they don't cut themselves or cut their lip on it or hang it on. Just smooth the zinc oxide eugenol and forget about it. There's no nerve in that tooth anymore. If it's not enough, you can reach in there and take a little more. It doesn't hurt the child at all to do it. And so you have taken care of it. You have eliminated the nerve on a healthy deciduous tooth, and I've done thousands of them, and I have never had one to go wrong. The only one I had that went wrong that I knew of for sure was an oral surgeon who was an MD and an oral surgeon, and the dentist was afraid to do it, so he sent him there, and he didn't know anything about packing zinc oxide eugenol into a tooth. I wouldn't expect him to know it. And it did not work, but the thing worked anyway, even though the tooth abscessed and it had a drainage, and it got rid of it as soon as we got rid of this tooth here, the drainage was over anyway. So it didn't keep it from working. Now here, you go to the other side, you're going to take off a big chunk of that tooth and go down with it, do the pulpotomy on that side too. And now we pack the zinc oxide eugenol in that hole. Look how we stuck that stuff onto a big spoon, and we're going to shove it down in there. And I take an amalgam plugger and mash it down in there, and then put some more on it, smooth it, press it down, and just kind of round it off a little bit, smooth the tooth up here, and leave it alone, and nature will take care of it. It'll move these teeth over into this space. This tooth will come in here, and I'll show you in a few minutes here just what happens in the case. Now we've packed it in there with an amalgam plugger and smooth the thing off. And now we aspirate in there and clean it off and smooth it up. And now this is 777. I don't know, and I've got her name in there. We took this, you see where that tooth is back here. Now watch that tooth. The tongue, when they swallow, pushes the tooth into place. Here we'll go then. There it is. And now it shoved it right up in here, and this midline is getting closer. These are moving in this direction, and the next thing back, we'll lose this, and we take the other one out, and we cut some off of the deciduous second molar, and you can take your x-ray and figure out. And we'll do this on the upper two to start that out. I'm going to buzz through this. I'm taking a lot of time doing this, but we whack these off right here, do the same moving thing, and they move into place too. Now the uppers come in place, and now look where these bottom teeth are. This has filled up every bit of this space, moved over here. The midline's still not completely on. All right, there you'll see the upper teeth come in. The bottom teeth look like that to start with after we got through with the bottom teeth, and now they're like this. This will come up a little further, and that'll slide over a little bit over here, and this tooth will come in. The tongue pushes on this, and the lips catch it back here on a normal, functioning, breathing properly, swallowing properly. If they've got some deleterious habit that affects that, you can't expect them to come in there. Now we leave that alone. The uppers come in, and I'm going to buzz on through this to the second part. Now then, when this goes along this way, and we lose the deciduous cuspid, now these have lined up. Look how much nicer this is. And we've lined up and folded in place. I have not touched them with a bracket or any kind of orthodontic appliances or anything. Why in the devil people start doing this. I've had very few people that actually do it. So they're going to send this out all over thank goodness for this YouTube stuff. And we are able to let people know about it. Now the next phase of it, when your cuspid tooth goes down here, here's a cuspid tooth way over here, we're going to take this tooth out. That's the first deciduous molar. They'll be removed, and we'll look on the Panorex, and I see how much space I need here. I'm going to cut that much off of this deciduous second molar right here and do a pulpotomy in this direction, and then this tooth will move into that space, and this cuspid will have room to come in place. And you still haven't touched them with anything like that. Now we've extracted that tooth. Here's this cuspid back here. It'll be moving over here. I'm going to come in and take this off, and this bicuspid will come up, and it's bigger in the crown, and it will slide over into that space, and I've got plenty of space for the second bicuspid to erupt into the mouth. All right, we take the deciduous tooth out. Now we take a long shank round burr, and we've cut the side of this tooth off. I didn't see it there, but anyway, we're going to go in here and we're going to take the pulp out. We'll go in and go down, and then go down over here, and then we're going to pack it from up here, and all you need is zinc oxide and eugenol. I did this in Boston one time, and I had the professors of 3 dental schools in the pediatric department, and they had to fit something else in there, more than that. But all you need is zinc oxide, a pure zinc oxide, and eugenol, and mix so thick you can pack it like amalgam. Now, here we're going to go into that tooth like that, and go down both roots with that. Then we come in, we cut the zinc oxide and eugenol, and I'm going to pack it into that tooth. And you pack it in there and shove it in with the zinc oxide, there. Now the little girl's unhappy with you for doing this, but that, if I'm not mistaken, this very little girl grew up and married and went off and had a child of her own, and brought that child from another town into my area so we would do this to her child so she wouldn't have to wear braces and stuff. I don't want anything against braces, but you're doing orthodontic work without putting anything on the teeth. So she's looking at you, and you know what she's saying to you too. I wouldn't want to repeat that, but anyway, there it is. And now we'll watch this go. Now, look at your midline. It's right there. These teeth, these lateral and this one over here, you can't hardly tell the difference in them. The cuspid tooth that was down in out of the way is in line over here. The bicuspids are in there, and the second bi will come in right beside that, and it'll have another one. You don't have control over the upper cuspid, but it'll come in pretty close. And this is done this with nothing in the mouth. Nothing. We didn't put a bracket or anything on there. And this is where these teeth need to go. I don't give a darn what kind of cephalometric stuff you're going on and telling you where to put the teeth. Be careful when you take from the self where you think the teeth ought to be. This is where the teeth ought to be. The lip pressure on both, and the tongue pressure, and all the pressures that are on these teeth. The teeth are in this position, and that's the correct position for those teeth right there. And you can do any cephalometrics you want to, and it may tell you to put them somewhere else, but that's not where they want. This is where things are balanced. The tongue and the pressure that's exerted from the inside is equal to the lip pressure and the mouth breathing, the nose breathing, keeping the lips open, and that's where the teeth will go to, and you don't need any retainer in that type of situation. Now, I do think people ought to allow children to chew and gnaw bones and keep from getting deep bites, which is bad. Now, this is went like that. I'm going to run through this real quick. You'll see the deciduous. All right, there's where we took those cuspids out up above. We took the bicuspid down. We've got more than a room enough for the second bicuspid. Then this will drift into our class 1 relation. And there this bicuspid came up like this and just shifted back in here like that. And you see the first bi here. Wait a minute, this is the cuspid. And your second permanent bicuspid will be in here, have plenty of room, it'll come in. This tooth will drift if it needs to come forward a little bit to get into the 6 keys occlusion. It'll come in correct. Now, why in the devil can't dentists see this happen, and why they can't go ahead and do this for people? There's a lot of people would want this done if they just could know about it. And I've done doing this for over 40 years. And there are very few people. I know a few pediatric dentists that are doing this, but there's very few that do. And it's just letting nature do this job, what it ought to do in here, and you're helping it out. That's all. And I have not touched this case with an orthodontic appliance whatsoever. So here's the little girl after we got through with her. She's a little happier down the line. And if I'm not mistaken, she got married and brought her own little girl in to have this done. So I'm going to say goodbye and thank you for watching. And for goodness sakes, somebody have guts enough to try this. It works. And I'm not pulling your leg. I've done case after case of it, and I can, they're all around over the country. So I'm going to say goodbye and try it. If you will do it, just leave the tooth alone. Pack the zinc oxide and eugenol into the bloody tooth where you have done the pulpotomy. You do not need a rubber dam to do it. You can't even do it with one. You get it out and grind the darn rubber dam. And whatever's in that tooth, the zinc oxide and eugenol has killed the germs that are in there. And I've never, ever had one of these teeth that went bad. And I am not lying to you, but I don't care if you believe it or not, but that's the truth. And I want you to do something with it, and I hope this lives on after I'm dead and gone. So I'm going to say goodbye, and we'll get through here, and I'll stop this. Thank you now. And join our group and subscribe to it. I need a few more people on that.